I was lucky enough to actually do an audition here as a med student, and I really loved it. I fell in love with the people, really. All of the seniors and the interns I was working with were absolutely amazing. The people were great, the location was great. It was kind of just all the stars aligning.
I was fortunate enough to rotate here as a student. I was, able to be immersed in lectures, meeting different departments, and just from a people standpoint, I really enjoyed it.
We use the word family here a lot. We very much know all the fellows, all the faculty. The faculty are very approachable.
In my almost year and a half in the residency, I've yet to be in a situation where I've had an attending that wasn't attentive.
They're also really supportive in, helping you get involved with research. Our fellows are also really supportive in that. You never feel like you're alone here, which is really nice.
I knew that the training that I would get here would be second to none. I've had a lot of people who graduated in years gone by who've said great things about the program.
This is a program that expects to have graduated responsibility. And so early on, we'll have extra supervision from seniors for interns so that way they can feel comfortable making decisions with somebody who's right on top of them to be able to help them.
As you go into year 2, now you're a little bit more solo. As a second year, you're able to provide care not just to patients independently, but you're now teaching those first years.
And then before you know it, you're stepping into third year, you're leading a team, you might be interviewing for a job, you might be interviewing for a fellowship program.
Then we actually give them a fair amount of independence on seeing their patients in the outpatient setting in particular, where they really feel now they've been following patients for 3 years and they are their doctor and taking care of those patients. What I love about Jacksonville, a lot of big city amenities, but without a lot of big city problems. And that's what I really like about being here.
There's so much to do. I'm kind of an outdoorsy person, and there's plenty of really cool nature walks and hiking that you can actually do here. The beach is of course right there.
You have kind of everything you could ever want. All the little neighborhoods are so cute. Avondale is kind of more artsy. San Marco has a lot of restaurants and things and places to hang out.
And yet there's not a lot of traffic, which I think is fairly great. In 20 minutes, you can be wherever you want, even during peak hours.
Residency is hard no matter where you go. There's nothing really going to change that. If a residency program isn't hard, it's probably not the right place for you because it's not going to challenge you. But I think what sets our program apart is the collegial atmosphere, the pathology we see. Dr. House has a saying, if we can dance here, we can dance anywhere. And I've found that to be true so far.
About 75% will go into a fellowship, and I think that's great. And knowing that, we will do our best to prepare them to be successful in getting into the fellowship that they want. That other 25% will either be hospital medicine or primary care medicine, and I'm very proud whenever we have some that go into that field as well.
I feel really confident doing a lot of procedures that I know from having my other friends who went to different programs, they haven't had the opportunity yet because at their program, it's more the seniors do procedures and interns watch.
I had an idea of what I wanted to do as a fellowship early on, and I was assigned a mentor in that field who worked with me, met with me several times a year. The support you get from not only the internal medicine faculty, but all of the subspecialty faculty really helps and supports you.
As a person who came in loving procedures and wanting a program to help me with that, this program checked all those boxes for me. And so it has made me fall more in love with MICU and the idea that I want to do home crit. So I'm keeping with that for now. There are things I haven't tried yet, but we're keeping with that for now.